think it's just a cool device and we just use it. But it is very addictive. It has a very high content of nicotine that they do not feel it when they inhale it. It gives them a very smooth fog that they breathe. It gives a pleasant sensation. In particular, if it is flavored, they're actually enjoyable. Why are they becoming popular and how they can be bought? Some of them are already told you, but this has become very popular because they are the companies are targeting the right people through the right media. So they go to social media, they produce jewel parties, and then they have very attractive pictures of people having fun. And then you go to the website. The only thing you need to say is that you need to declare that you are above 18 years of age with no evidence of any certificate or any proof of that. You just click that I'm more than 18 years old, and you get access to all of this with very good reviews, very good colorful things. It's like you buying ice cream, mango ice cream, watermelon ice cream, different taste. And they try to convince young people that these products are harmless and they are fun and they are very successful in that regard. Because these products are a lot easier to access, the teenager needs to have a credit card, and some of the teenagers already have access to Bitcoin, so you never know what they're actually buying and where they're buying it from. It's an easier access. The peer pressure of the other friends is the biggest problem. So people just say, it's cool, let's try it. And then they just try it. And these products are changing every day. There's so many different products and they become more attractive. They become more marketable. They become easier to use. And as I said, some of these manufacturers just find some loopholes some ways to go around the loopholes by not declaring the nicotine and saying that these are the devices that helps you to give up smoking and so on. So that's why they become popular. Now, in the last few years or 2 or 3 years, there are some other products that are coming to the market for the teenagers to give up e-cigarettes. So they say, look, you go and buy Zyn to give up e-cigarettes. But Zyn also has a pure nicotine salt in it. Again, very high concentration of nicotine. They say this is tobacco-free nicotine product. And these are now becoming another generation of nicotine products that become very, very addictive and very appealing to the youth. The flavors in e-cigarettes are very, very important. So the flavoring of the e-liquid makes the initial exposure a very pleasurable exposure. And this causes the recurrence of the tobacco use eventually. Importantly, nicotine is a gateway drug that lowers the threshold for addiction to other agents like opioid, cocaine, heroin, and so on. And it's very, very addictive. So it's not just inhaling nicotine. It is a gateway to start other problems. And it's been proven in the literature, as you can see, again, published in this article in 2019. But people say there's nothing to worry about. There are papers in favor of e-cigarettes that they have helped people to give up smoking. They're not a problem. This was what we knew mostly up to 2019. But when we go and review those articles, we see that there is a lot of conflict of interest within the authors. The paper that did not have a conflict of interest show evidence of harm, apart from one article, and that article was just a paper that was an outcome or a summary of a meeting. And when people went and looked at those people who were in the meeting, a few of them have some association with tobacco industry. So they had some funds and they not being paid directly to say that, yeah, I've got money from tobacco company to go and buy a car, but they were just writing books about smoking and smoke cessation. They were like advertising about e-cigarettes in smoke cessation. They were been promoted and have funds from tobacco industry. But when we look at the epidemiology of the problem, again, this was published in 2019, you can see that in this article, this is in England, Within the year 12 boys, in 2017, 11% of them tried vaping in the last 30 days. A year after that, it almost doubled to 21%, and in 2019, a year after that, 24%. Among 10th grade, it rose from 8% to 16% in a year, and then 20% the year after. And when you go to ever smokers, I go to the last, like the one before the last column. In the 12th grade, 25% of them said that they have used it once. In 2018, that number increased to 34%, and in 2019, 40%. So on average, 30% of 16 to 18 years old in England use them. And there are young people who have never smoked, and now they're starting e-cigarettes. Perhaps if you were following the trend that I mentioned initially, these young people would have never touched cigarettes, but 30% of them are now going to use e-cigarettes. Now I want to talk about the problems. What are the problems of e-cigarettes? Are they actually worse than the normal cigarette? Is the guy in that cartoon, is he right or not? So then there was a publication in October 2016 about the health effect of electronic cigarettes. They said that these are what is in the liquid in the e-cigarettes. So the listed gradients on the package is glycerol, propylene glycol, and nicotine. But when you actually put that into the machine and find out some more about them, they contain acetone, acrolein, cyclohexene, ethanol, formaldehyde, and some of the tobacco alkylate. These things that I mentioned, some of them are very well-known carcinogens, like formaldehyde. Even if you just smell it, is a carcinogen. Let alone if you heat it up to 100 degrees and inhale it constantly several times during the day for 10 years, who knows what's going to happen. So ENDS is the electronic nicotine delivery system. They use solvent to heat and aerosolize various aldehydes and alcohols. Mixing and aerosolization of these components, they can create new components. Who knows, if you heat up formaldehyde to 200 degrees and mix it with propylene glycol, what comes out of that? So there will be 1,000 other chemicals that can be produced by mixing and heating this up, but that we do not know yet. There was a cluster of cases in one of the states in US around the same time that we went to the conference, and 53 cases within only a month in 2019 presented with respiratory illness. They had some constitutional symptoms, and they were affected by e-cigarettes. The median age was 19 years, 83% of them were male, and 80% of them reported nicotine use, and 61% of them THC, which is a marijuana family type medication. When they presented to emergency with these symptoms, 100% of them had abnormal CT scan, 94% of them had to be admitted to the hospital, and about 60% of them were seriously unwell and went to ICU. There was another outbreak of lung injury linked to vaping in 2019, 530 cases, 72% male, and 16% of them were less than 18 years of age, and 67% 18 to 34, all young people who had respiratory symptoms, and 13 of them died in ICU due to the side effects of vaping. So it's not an easy device with no side effects. It can kill people acutely, and we don't know what's going to happen in decades to come. If I want to show you a person's CT scan, a normal CT scan of the chest, where you see the normal lung tissue there, a heart there, and the left lung there, that's what you see. If I show you a CT scan of someone who smokes for 30 years and get emphysema with all those black holes, which is basically the lung burnt out, is what you see on this picture. And if I want to show you someone's lung who is affected by marijuana, which produces very big cysts like this at a very young age, like 40 years of age, I would show you this CT scan. But what I show you with vaping is a different mixture of different diseases. Like they get so many different conditions. Like each of this picture here is a different disease. which means it like requires a different treatment, has a different progression, it's just a different disease that can be produced by vapes. And we do not know what's going to happen next, what disease is going to be caused by what inhalation. In addition to that, there is other side effects of cigarette smoking. The batteries can heat up and they can burst. And then there was another publication in 2016 showing that people burn the face, the hands, the legs. Like this guy had the e-cigarette device in the pocket, and then it just exploded, and so on. So there is other risks. And as I mentioned before, the use in pregnancy, passive smoking effect, they are bad. They can affect the fetus, they can affect the pregnant ladies, they can affect people who are around the smoker. As a result, there is a position statement in Australia and New Zealand published in 2020, similar sort of statements across the world in European Respiratory Society and American Thoracic Society. They suggest access effective existing cessation treatments for smoke cessation. E-cigarettes should not be used by non-smokers or for extended periods by ex-smokers. E-cigarettes are not suitable consumer products. The sale or supply of e-cigarettes, e-liquids, and devices to people at age 18 years old should not be permitted. Flavors in e-liquids are attractive to young people and never smokers, and we should consider putting bans on flavoring the e-cigarettes. Now, this helps us to find out what is the next step that we have to do as a school and as parents. We are advocates to provide information about these products, and I would like to have some more advocates to pass on the message. We need to correct the misperception that this is okay. This is not okay, and this is actually worse than smoking. We have to embed that into our education. We need to have peer leaders in high schools and middle schools to tell other people about this. Young people, we need to inform the young people about this, provide them with this information, and let them decide, let them make their own mind. And then, but they need to know about this, because what they know is the Juul party. It's fun, it's cool. They don't know about the rest, and we have to tell them. And maybe they can encourage their friend not to be using these products. I was thinking maybe as part of school work, they can produce some animation and video clips. I think the school can promote that. They can have like e-cigarettes as a topic and then produce animation video clips. They publish that on their websites and social media and share it with other people. I think that might be helpful. My understanding after talking to my son, at least, is that e-cigarettes is not a big problem at Camberwell Grammar School. Those are statistics that I told you, 30% of teenagers in UK using that is not true, at least in our school yet. But if nothing is done at school or more broadly through the state or the country, that will become a problem. So in summary, if someone says that we want to use e-cigarettes, the short answer is don't. Do not use e-cigarettes. They may be used only when approved treatments fail in current smoker for smoke cessation under observation and recommendation of a healthcare professional. The efficacy and safety of e-cigarettes still need to be evaluated in high-risk groups. The sale of flavored nicotine products should be banned. Harm reduction through the use of e-cigarettes must be avoided. I will not tell my patients that you use e-cigarettes. It's a less harmful device than your cigarette. And perhaps I go back to 10 years ago, and I do not want to say that I agree with the old man, but probably that's what the truth is in comparison to e-cigarettes. That's the end of my slides, and thank you very much for providing this opportunity to present this.
Oh, great. Well, thanks, Ali. That was scary, but fascinating, and I think you did a fantastic job at stepping through the whole process and the reviews, and usually I'd try to go back and